Hi everybody, this is Dr. Hinson. I wanted to talk to you a little bit about a case study. I had a patient come in the other day, and I wanted to share this case with you because the things that we're able to help with applied kinesiology are very vast and very broad. And sometimes, you know, people, when they hear that I'm a chiropractor or have a chiropractic degree, they kind of come up with an idea of exactly what it is I do. You know, he pops bones or he does adjusting and things like that. But I thought I'd share this case study with you just to kind of give you an idea of just how broad the scope of practice is, utilizing applied kinesiology techniques as well as some other neurological techniques I've picked up over the years. So this patient comes in yesterday. She's had a trans-ischemic attack, or a mini stroke, and she was pretty scared about it. Of course, she'd never had anything like this before. And so, of course, it frightened her, and fortunately it wasn't worse. And so I thought, you know, she came in to see me. She wanted to know if I could help her. And so what we did is that we really focused on improving her neurological function. And the way we do that in the office, you know, making different adjustments is one way to do that. But in her particular case, what we found would be best suited for her was to use low-level laser in an attempt to strengthen nerves as well as hopefully strengthen her nervous system so that she doesn't, you know, have this problem again. And so, you know, our nervous system controls everything, and it controls, you know, pretty much our organ systems, how we move, how we sleep. Everything is controlled by the nervous system. So, you know, our brain's encased in our skull, and all of our spinal cord is covered up with the spinal vertebrae. And so if you can see this chart behind me, you see you got nerves coming off the spinal cord up in the neck and in the low back area. But over here in that little corner right there where you see the guy's head, those are the cranial nerves. Those are nerves that come directly off the brain. And the cranial nerves are actually very small nerves. They affect so many different functions. Everything from our sense of smell, our vision, our ability to move our eyes in different directions, peripheral vision, things like that, our ability to see things coming at us and see things going away from us. This is one of the reasons why when I work with athletes, we always check the function of one of these cranial nerves, because it's going to control how well they see a ball, you know, coming at them, and it's going to, you know, affect their ability to respond to that. In this particular patient's case, what we did was evaluate all of the cranial nerves, and there's 12 of them. So like I said, sense of smell, eye movement, our tongue movement, the hearing, balance and coordination, you know, how we feel, you know, things on our face, how our jaw moves, our ability to speak, like our voice. And one of the biggest things I worked on with this patient was improving the function of a nerve that is actually getting a lot of attention in the media these days, the vagus nerve. This is the nerve that controls our digestive organs and also controls our respiration, our heart rate, blood pressure, etc. It's a very, very important nerve. And so while we can affect that nerve with chiropractic adjustments and other corrections to the body, utilizing laser light's a very unique way to also influence this nerve. And so one of the things we had her do is, since this nerve is involved with the swallowing mechanism and our ability to produce vocal sounds, we treated that nerve, and many times patients, after they get that treatment, will turn around and say, man, I slept so good, or you know, their digestion improved, perhaps their bowel function improved as well. It's very, very common to hear those reports come back to me after we treat that nerve. So when someone has a concussion, traumatic brain injuries, which we're hearing so much about, especially in, you know, athletes, especially, you know, football and soccer players, this is one of the things I always wanted to evaluate on people who suffer strokes, people who are in athletics, in contact sports that involve the head, is that when you evaluate these nerves, you're able to find out just how well these nerves are functioning. And sometimes, you know, when a cranial nerve is malfunctioning, it could be from anywhere from mild to devastating to that person. And so it's super, super important. You know, you see kids with ADHD and ADD, kids who have a hard time concentrating in school. When you start to evaluate these nerves and improve their function, it's life-changing for a lot of people. And so, you know, it's remarkable, because I've seen people with brain aneurysms and full-on strokes have amazing recoveries when they get their cranial nerves evaluated and treated, as well as their nervous system as a whole. So if you know of someone who might be dealing with some of these problems, let them know that this type of treatment exists. It can really make a big difference for them and really change their life, and I'm sure they'll thank you forever. So if you have any other questions about cranial nerves or any other health-related question, send me a message and I'll be happy to respond, and talk to you guys later.